Okay, once again, my name is Keith Washington. I'm the VP of Products at ProSites, and we're pretty excited to talk about speeding up patient onboarding with online forms. And a number of people, most of you know what an online form is, but we'd like to spend some time talking about what we think are important components of online forms and really showcase something that we find is really exciting is the ProSites Dental Symphony online form solution. Our agenda for today is to talk about the different types of online patient forms, to talk about the benefits of online patient forms, to talk about our online forms, our solution, provide a brief demonstration for you, and then answer any questions that you may have. We're pretty excited, and we've seen a lot of practices really adopt this solution and want to make sure that you get a chance to know about it and perhaps incorporate it into your office. Just a little background. What are most offices still doing? And we spend a lot of time surveying and talking to our practices, and most are still doing paper forms in the office. And as a person who goes to the dentist, I find this to be the standard practice. Every time I go in, especially at my yearly checkup, if I go in for 6 months, I don't usually have to refill out my health history form, patient information form, but once a year at least, I get a form on a clipboard, and sometimes the pen doesn't work, or I have to fill out this form where I don't remember all the information. I don't always check all the boxes. I certainly scribble some information that I think maybe isn't important. And what the practice does is take that form and scans it into the practice management system and shreds the paperwork. And it's obvious, as we go into the digital age, that there's some limitations in this whole process. Many practices from that point have started to have a downloadable PDF. So most of our customers have on their website a click to download a PDF. So a patient can print a form at home and complete it at home. It really is still static data entry. It requires me to have a printer, and I still write the responses on this form. And then you have to either rekey the results or scan the results. And then, as usual, you also have to interpret what I wrote on that form. It does save me time, potentially, as a person, if I remember to download the PDF or I'm instructed to download the PDF. But that's about it. It saves a little bit of time. It still is fraught with potential errors. Many other practices have moved to a fillable PDF. And that certainly is a benefit where you can, as a patient, I can complete the form online and print it at home, or I can send it through the email. It still is a static form. It still may require a printer. Some of them may have the opportunity for me to save my information and complete it later. But the email send may not be secure or HIPAA compliant if I'm just sending it through the straight email system. Changes to the form, so we create some forms, have in the past created forms for practices where if you want to change a particular section of the form, it requires a rebuild of the entire form. The way PDFs are built, you build them as a whole group, and then sometimes if you may want to make one small change, it requires a restart and rebuild of that whole form. You're not able to save information between visits or know about differences between visits. So it does save time and reduces some errors, but it still isn't a holistic solution. What we think is important in the future is a secure online form where patients can complete the form online, the data can be presented automatically to the practice, a form that's customizable where you can send and exchange information securely and is HIPAA compliant, and then I can make changes or the patient can make changes without having to restart a new form. An online form really saves time, so because you can focus on patient care and not on form fills. It reduces errors. It can be compliant, and it's interactive. And so what we see as the future of communication with patients is through an online form. Some of the benefits, as I've talked about, first of all, no more paper forms. Patients don't like filling them out. I don't like showing up in the office or having to show up early or to show up for my appointment and spend 20 minutes. as I talked about before, mistakes are made sometimes and data is misread. You can't tell whether I checked this box or that box. One of the key components is whether or not I have what medications I'm taking. I don't remember the name of it, and so I may mistype it and say something, miswrite it, or say something else. With an online form, a patient can properly, in a practice, can properly prepare for the appointment. So if you can get a patient to fill out their information, health history, medical information, and patient information before the appointment, you can identify potential issues in advance and ask questions in advance of the appointment. And this speeds up treatment. Imagine the ability to be able to have a patient show up. You already know the critical information. You already have collected everything that you need, and you can get the patient to treatment and triage. That is what we think is important. And also, it's easy to update patient information. So returning patients, and something that I would like as a patient, I don't have to start over every time. I can focus on any changes that I have in my medical history or my patient information or my insurance, and not start over with, what is your name? What is your address? And as a matter of fact, and Darren will show you that information as well. What is important in terms of updating that information? Another benefit is the ability to pre-validate insurance information, so you can find out what coverages that they have before they arrive in the office, and that's really important. And then you can improve security and compliance. I've already talked about that. Having an ability to securely enter that information and exchange that information is vital. I can't tell you enough how many times I see practices sharing or trying to use their email system to share critical patient information. And it improves probably the most important thing, it improves the overall patient experience. The patient interactions in your office become efficient, they become effective, you're on time, you're not dealing with corner cases or issues that you didn't expect, and they feel like they're in a professional environment. So ProSites and Dental Symphony partner together to provide what we consider to be the most robust online form solution in the industry. So we're really focused on being able to provide this critical, important patient interaction through an online form solution, which includes, and I'm just going to quickly highlight some of the key features before we do the demonstration. Custom registration portal, customizable online forms, so that if you have you can have your own health history form, patient information form, a HIPAA acknowledgement, and you can access this online from any device. Probably the most important thing that Dental Symphony and our solution provides is a pre-clinical assessment. This is unique in the industry, where practices in your practice can receive an interactive, medically assessed patient review so that you can determine critical risks, any medical conditions, and more. Every form includes an e-signature. We also support specialty dental forms, and there's seamless integration with practice management systems, so you don't have to rekey information or scan in information that is created by the patient. So I want to spend just a minute with Dr. Tom Cockrell, who created this solution. Dr. Tom runs a dental practice, a special needs dental practice in Texas. He's spent a number of years trying to figure out how to optimize the patient experience, and he's going to give us a little bit of background on the Dental Symphony solution that's called ePatient.
Great, good. Keith, thank you very much. That was a really nice overview. Welcome, everyone. It's good to talk to you today. My name is Tom Cockrell. I'm a practicing dentist. Been at it for several decades over here in Texas, and my practice is focused on special needs patients. And some of the things that I began to run into as I was working was patients who had complex medical histories, taking a lot of medications, and sometimes it was just difficult to sort all that out and make sure that the work that I was doing was carefully done, and that I knew how to take care of my patients. And I began to talk to some of my colleagues about some things that would be helpful to us as we dealt with our patients that are living longer with chronic disease and taking a lot of medications. And so we began to think about some processes using a medical history collection device that would gather deeper information than you typically get just from checking off a piece of paper, which is what most offices do. So we developed a computer digital system that would provide follow-up questions to a medical history that was submitted, and we added to that the drug descriptions for medications that they take, and also a way to analyze the information so that we could provide some alerts for the dental team. And then we also, over a period of years, added a point-of-care support system for managing that patient. Well, that was long enough ago that this was before online forms, and we had this device that was created by colleagues, but we needed then a way to get it in front of people. And so this was still before online forms were in use, but we knew that that would be the way to do that, and that is attach it to a device that would collect patient information that was of need for the front office, essentially a registration system. So that's what we did. That's how we got started. We were a clinical system before we were an online form system, but just nicely dovetails together. And we eventually created ePatient, which has then been adapted to the dental office culture so that it works very well for the front office staff for the things that they need, and then also for the clinical staff to then meet the original goal of the clinical team that created ePatient. Some of the things that you'll see in the demonstration are the notification page, which makes it easy for the front staff to keep a log of who's registering, and then the medical history summary you'll see, which is really a very powerful feature, and the clinicians amongst our audience today will recognize that, I'm sure. Everyone in the office saves time when they use this because we don't have to sit with patients and review their information, ask follow-up questions. It's just a wonderful adjunct to the practice. And then finally, use of it helps us as clinicians practice safely, confidently, and competently. Keith, if we can move to the next slide then, just to show these are the clinicians. Information about everyone can be found on the Dental Symphony website, but essentially these were colleagues of mine in academia and clinical practice that shared my vision for ways to help the dental team practice more safely and confidently. I thank you for the opportunity to visit with you all today on behalf of the Dental Symphony and ProSites team. So we can move, Keith, I think, right to the demonstration with Darren.
That's right. So at this point, we're going to go to show you how it works. We're pretty excited. It's probably the best thing for you to see how easy it is to use the online form solution.
Hi, guys. My name is Darren. As Keith and Tom have said, I'm going to walk you through how Dental Symphony works today. I'm going to walk you through kind of the patient side of things, move through the staff side, and then more into sort of the clinical information that we provide that Tom talked about. So you should see my screen, which is sitting on just a sample ProSites website. So an office that's using ePatient typically will have the forms linked to their website. So this would replace the sort of, if you're using downloadable forms or PDF forms, instead you would have a link that's going to jump your patients over to the patient registration portal. There we go. And so once it lands on the portal, patients can move through it for the first time. They can also go back in to update. So I'll walk it through from the beginning. It's going to walk them through office policies first. This is provided by the office. If you have office policies, things like appointment fee or cancellation policy, anything like that, we do collect the electronic and physical signature ahead of time so that you don't have to really be dealing with any sort of signing and paper when the patient gets to the office. We also handle HIPAA. If you're in California, we also handle the dental materials fact sheet, and we do an affirmation that the patient is who they say they are. The information is going to be complete and accurate. We provide a signature pad as well, where they provide a physical signature and then also retype the name of whoever's signing the form. So if it's a parent or something like that, or parent guardian, you'll see who it is that's signing and submitting the forms. Once they've made all of the agreements you need, they move on to the form side. We do provide default forms. You can certainly use everything that we offer. You can tailor it down based on what you need, or as kind of Keith mentioned beforehand, you can also create custom forms if there's just something really particular to your office that you need. But it's designed to walk the patient pretty quickly through everything. Name, address, phone number is what it starts with. I'm going to do just the required fields to get us started. And then move us down. So you'll see it walks through address, phone number, employer information. A couple of notes about this. This is our general form or our general account. We do have a pediatric specific version so that our pediatric practices, the form is slightly different since the information you guys need is going to be different. We also have buttons that save the patient time. So for example, if they're the responsible party for the account or they're the policy holder of the dental insurance, they can check the boxes and it'll take their name and their address and their phone number and their employer and essentially drop it into those other forms so that they're not having to put that in over and over and over again if it's all going to be the same. It also is a responsive design portal, so it does shrink down, stay usable, stay readable for them if they're on a mobile device. So they can use it, you know, from their home computer, from their phone, from a tablet, wherever they are. And then they can upload or take a photo if they want to attach that as well. Once they've created their profile, on the staff side, the staff is sent a notice that the patient has been created, but it also will activate for the patient any other forms that are turned on for them on their portal. Once the patient has moved through the patient portal side of things, it walks them through any forms that are up, name, address, phone number, insurance, medical history, dental history. All of that output comes in for the staff in a PDF output, but instead of just providing the output of name, address, phone number, and initial information, it also creates for the staff a medical history and a dental history summary. What that means is that anything that is submitted by the patient for any medical conditions, it's going to pull that together for the staff and provide additional information. So instead of just seeing, you know, they clicked the diabetes button or they clicked the asthma button, something like that, it's going to highlight alerts for the practice. It's going to give, in this example, you're seeing susceptibility to infection because there's a diabetes alert. You're seeing a bleeding alert because they reported use of Plavix. You're seeing also an inconsistency alert because in this case, the patient reported the use of an asthma medication and then also the use of a hormone medication, but they didn't actually select either of those conditions in their medical history. Let me try this one more time for us and see if it'll move back through so I can actually show you the patient form. I'll do these same things again, create a profile. There we go. So it's brought us to the rest of the forms in this particular account's patient portal. So you'll see the list of the forms that are available. This changes per practice based on what you need and what you want up for your patients. So the output that I was showing you comes from our default medical history, which is right here. It walks the patient through basic information, any reported conditions, any conditions that they're being treated for currently. I'm going to select diabetes as an example just so that you can see an example of the additional questions that we'll ask. So it walks them through any medication, allergies, any other allergies, some specific questions for children and women, preferred pharmacy, We also provide for the patient, instead of just giving them a box where they can type in any medications they're taking, we give them a button that they can check that will actually open up for them a medications library. This is really helpful because it means that you're going to see from the patient the correct spelling. You're not going to be kind of decoding whatever their handwriting looks like. It gives them several different ways that they can select medications. Alphabetically, they can search. They can also type to filter the list. They can search by category as well, and it's going to open that up for them to select and add into their form. So then once they've added it in here, on your staff side, you get the correct spelling, you get any drug descriptions for those medications, as well as any drug interaction or drug reaction information. So assuming I've moved through this form as a patient, I'm going to save it. If I don't have anything going on, if I don't really have any complicated conditions, it's just going to move me on to whatever the next form is. In this case, I reported diabetes, so we go ahead and automatically provide for the patient some additional questions to walk them through collecting more information about that condition. So this is not really everything you ever wanted to know about diabetes. Everything is tailored towards, you know, what is going to be relevant to the dental practice, what might mean that you guys need to treat them differently or refer them out or, consider things a little differently for them. So they just walk through any additional questions that are presented based on their initial health history submission, save that form, and it moves them on. So it essentially walks them through each form. One other button that we do have for offices, it's used a lot by our pediatric offices, is the Add Edit Family Member. So I'll jump down here just so that you can see that. If you want to provide the ability for patients to create families within the portal, you certainly can. What this allows us to do is share basic forms between each family member, so that if you have an office or have a family that's coming in, they have several kids or they want to add their spouse, they don't have to submit things like dental insurance and patient information or address and responsible party over and over again. When they add a new family member, it will apply things like insurance and basic information to the next patient so that they, again, are saving time not having to do that over and over and over again. But I'll move back over to the staff side where I was before to highlight our desktop shortcut. This is provided to each office that's using us so that we don't ever have to email you any patient information, so that you guys aren't emailing patients forms and they're not emailing them back. They come in to your office through our desktop menu, through what we call our notification list. Before I look at the notification list, I'll also highlight just quickly the email button that we provide. In case you have a practice where you don't want to just direct everybody to your website, but you'd rather email them the link directly, you certainly can. We provide an email option so that you can send them in the first time through email. You can also send them an update request so that if you ever need them to go back in a year later, 6 months later, kind of harkening back to what Keith was saying earlier, it eliminates the need for that the update form. They get to go back into our system and update ahead of time so that they're never having to look at a blank form and submit new information or do the kind of shortened update form where it just kind of asks about changes. They get to log in and review what they previously submitted. But what I've opened here is the notification list, which walks you through any incoming patient forms. It'll give you the name of the patient, whether they're new to the system or whether they're updating. It also gives your staff the ability to check to see which forms they filled out so that your staff isn't wasting their time looking at and dealing with forms that are not yet finished. So it does color code them so that you know which ones have been filled out, which ones still haven't been done yet. We also give you the ability to nudge a patient so that if a patient comes in and fills out half their forms but they haven't finished, you can send them email reminders with a link to get back in so that you can prompt them to finish that, finish anything that they need before the appointment so that you're not having to deal with doing anything in the waiting room. They should be able to walk in and everything is already set and ready for them to go. And then depending on how you want your practice to work and how you want your waiting room to work, we do work with iPads and tablets, whatever it is that you want to use. If you're wanting to set up a kiosk or a tablet system where if you do have those patients that just never go to the website or never respond to the email, but you want to eliminate that paper, we are certainly happy to set everything up for you on an iPad or a tablet if you want to eliminate that lingering paperwork for anybody who makes it all the way there and still hasn't done it. And then for generating the output, they work from, we call it the print button, but nobody's really printing. However, if you really want to print it, you certainly can. There's no rule that says you can't. But if I were to open this up, it's going to take us back to that output I was looking at earlier. That is the PDF output, the active form where everything is selectable, grabbable if you need it. It walks you through everything they submitted. I'll take us back to the medical history summary, and I'll give Dr. Cockrell a chance to chime in here about the medical history output and kind of the thinking behind how it everything is organized in terms of alerts at the top, and then walking you through reviewing a quick review of everything they said they didn't have before starting to break down everything that they do have. So Dr. Cockrell.
Yes. Thank you, Darren. Yeah, this is my favorite part, as you can imagine. If you can scroll back up, Darren, to the red alerts, these are the kinds of things that all clinical staff are most concerned about when it comes to evaluating our patients. Do they have susceptibility to infection? Are there hemostatic issues? And very importantly, are there inconsistencies between the patient's reported medical history and the meds that they take? Those are the kinds of things that we want to know right up front that will help us move the patients into care. If we can move down, Darren. Ladies and gentlemen, the next section is what we call a systematic report of the basic bodily systems, where you will, instead of just looking at a checkoff list, which you can look at, or you can look at this as if the patient had a summary provided by a physician's office, let's say, about each of the important systems. And here you see the results of the follow-up questions that the patient has submitted about heart disease. It's nice to know they have heart disease. It's better to know exactly what the issues are, and from a dental point of view. And then so you see the diabetes, and goodness, sometimes we don't even remember which questions to ask if somebody reports that they have certain diseases. Well, this will prompt the questions to the patient, and then give the answers that are so appropriate for the staff to know. Someone has to ask those questions at some point. It's good to do that ahead of time. Patients know that you're going to be very thorough and careful in treating them. If we can move further down, Darren, I want to point out further down to the drug descriptions. Oh my, this saves so much time in the office. You don't have to look up drugs. I mean, there they are, and it's a description of them and how they would affect the possible dental treatment plan. Darren, can we move to then the point of care support center? This is created for each patient, and it's unique to the submitted forms. It's a concise area where you can look at everything from how to treat the patient from a medical perspective to the interaction of the drugs. So you see that our team set about a process of asking, what does the dentist really want to know? I mean, really, we don't get down to it. What do they really want to know? And so questions like antibiotic prophylaxis and about local anesthetics, IV sedation, how do you prevent problems? If you need to call the physician, what do you ask the physician? Rather than just saying, can I treat this patient? We can do better than that. And these are prompts and guides to help the knowledgeable clinician on how to do that. So each of these are unique. Darren, if you can go back to the menu there of the point of care support center, they're created for each patient based upon the submitted history. And so thank you, Darren, for that time. You go ahead and back to your demonstration.
Sure, thank you. Yeah, so all of this information is updated and attached to the patient chart or profile whenever they submit our medical history or whenever they update our medical history. So it's a lot of information that is pulled together for the staff and for the clinical staff based on the initial input by the patient. So it shouldn't really tax the patient's time very much, but then provide a lot of output for you guys that can be very helpful if you're ever dealing with patients that are more complicated. So our goal is really to, give you a portal that's quick and easy and walks everybody through everything that you need, give you the ability to tailor it down so that it's asking what you need without wasting everybody's time collecting fields or answering questions that you don't use in your office. But then since we are clinically based, we certainly want to provide you with more than just a basic output with questions and answers. If we have the technology to give you extra support automatically, then we certainly aim to do that as much as possible. Yeah, so I think I'll pass it back over to Keith in terms of finishing up the slides on the PowerPoint.
Great, thanks, Darren. I think Dr. Tom wanted to be able to review this information, and that's okay if you'd like to do that, Tom, and then I'll open the floor for questions. Before Tom just gives you the final overview of the solution, just note that in your panel is a section, in your GoToWebinar panel is a section that says questions. Please feel free to ask them along the way, and then we're going to have a special time for you guys to ask questions. Tom, you want to just talk about the summarizing?
Sure, yes, thank you. We work hard in the office to present professional appearance to our patients, and we have technology now that's just unimaginable almost with the digital impressions and the digital restorations and CBCTs, and it's just amazing the things that we do. And I see ePatient as being very consistent with that goal of dentists and clinical staff and dental staff to be on the cutting edge and do a good job and for serious work for patients. And so ePatient is real helpful. I mean, it's it presents an image to your patients when they first meet you in your office of, gee, that this office cares about what they're doing, and they're trying to be helpful to me as I seamlessly get into the practice. I like the things, and my staff like the things, and I've heard hundreds and hundreds of customers just talk about how they like that the mom-friendly process for adding children from the family, the unlimited custom forms, and then the complex medical histories are made manageable for moving the patients into care. That's just so helpful and saves time. I might say, and we've not had a chance to show this, but within ePatient, there's an emergency management system that can be used for practicing in an office or actual use to help manage the patient if they have an emergency. So that's what we, as the clinical team that created ePatient, we're interested in, and that is providing safe care and increasing the confidence and the competence of the office. It's just really helpful in a number of ways. Keith, thank you for the time there.
Great. So I'm going to open up the time for questions. I see a couple of questions already, and I will answer questions in one of a few ways. Number one, I will read the question out loud if I think it applies to everyone for a little while, and then answer it verbally. If your question is specific to your practice or to your ProSites account, I certainly will answer that question directly to you online. So why don't we take a few minutes to do questions? And while we're doing that, I just want to make sure you know that the way you get this solution is through ProSites. Just all you have to do is give us a call or go to our online, ProSites.com. We have all the information about this solution as well as all of our solutions. It's on our online form solutions with Dental Symphony is sold separately or as part of a nice bundle that we've put together. So just give us a call, and our account managers will be happy to help you. I'll talk about that again. So let me ask, just see if I can answer some of the questions, and if not, Darren, you can go into more detail. Number one, are you able to transfer all the information into the patient's portfolio in EagleSoft? And I'm just going to say generally, you can transfer the information into the practice management systems. Our system works most closely with Dentrix because they have, you know, the most customers. But you can put the information into the folders for a patient, whether it's EagleSoft and many other practice management systems. So the key is that you're not having to rekey that information or scan that form and send it separately. You can drag it right into the different systems, or we have tighter integrations with Dentrix. How does a patient return to update his or her forms at a later time? I think Darren can answer that one. I can give you the generic answer, but oh, I said may at a later time, HIPAA compliant and securely. So Darren, just give them let's give everyone the quick answer for that one.
Sure. So patients can go back into update when you ask them to update. So you can email them, depending on which system you're using, it's slightly different, but essentially anytime you're doing it, you can send them what we call the update request. That gives them a personalized link to jump back into the forms. They're asked to verify their birthday. They re-agree to policies in case you've updated anything in there. And then they're able to walk through any of their previous forms, reviewing the content and making any changes. And then as they save those, it comes back in through that notification list I showed earlier.
Great. We had a couple of other practice management questions. It says besides PDF documents, does it tie into other software, practice management software directly? And I think we're talking about whether or not we're doing field for field matches, and the system doesn't do that because we don't want to overwrite information that you already may have into the system. But we certainly allow you to no longer have to deal with paper, and you can put the information, the form, the health history, or whatever forms you have, right into your practice management system. I have a question: do patients have to download a program, or is it safe through the web? You do not have to download a program onto your machine. This is a online cloud-based system that includes encryption and is HIPAA compliant. So all they have to do is to log in, as Darren showed you, or re-log in as we just talked about, and it is through a secure exchange of information, encrypted information, and HIPAA compliant, all through the cloud. Which is a great question, by the way. Thank you for that. Any other questions? Well, while we wait for that, I just want to, first of all, thank Dr. Tom Cockrell and Darren for giving us an overview of the online form solution through ePatient. I also just want to let you guys know again that please don't hesitate to give us a call if you have additional questions about that and about our solution or any of the solutions that we have, including websites and search engine optimization. Our goal is to help you keep and attract and keep the patients that you have. And that is our single focus in life. We think that being able to provide an online form solution really, as we've shown, hopefully shown, really upgrades the level of professionalism and efficiency in your practice. I'm going to answer additional questions online and in the webinar officially from an audio standpoint now. I really appreciate everyone joining. We will stay online for a few more minutes and answer questions online as needed. Thanks again, everyone, for joining. I really appreciate it.